things you can do to correct what you have and prevent from getting it. The most common thing you hear about is carpal tunnel syndrome. Okay? And we're going to tell you right off the bat that it doesn't exist. Okay? Carpal tunnel is this little tunnel down here in your wrist where the nerves pass through, two bones form together, forms a little tunnel. And the nerves pass through there to get into your hand. So oftentimes when you're having hand and wrist and your fingers are going numb or you got chronic pain, they would diagnose you as having carpal tunnel syndrome. Okay? And oftentimes they did surgery in the carpal tunnel to release it. And most of the time it doesn't work at all. And people that have one carpal tunnel surgery end up having 2, 3, 4, or 5 carpal tunnel surgeries. It is the #1 cause of lost work time in workman's compensation. Was very common in telephone operators years ago. Of course, there's no more telephone operators, but people were constantly using their hands. Real common in people that constantly use their hands or have repetitive motion jobs. And so what happened was, years ago, a friend of mine theorized that there were possible places between your neck and your arm, where your hand, where the nerves could become trapped. And so when the nerve goes to your finger, your brain, it comes all the way from your neck. And so when the fingers are having problems, that nerve can have pressure on it anywhere between your neck and your hand, and you're going to feel the pain or the problem in your fingers. Okay? The brain doesn't know where the pressure is, it just knows that that nerve is affected. So he started to do a technique like I do on most of you, stretch muscles and things, and there was this surgeon down the street who all of his patients were canceling their carpal tunnel surgery. Okay? So he kind of called up this chiropractor and says, "What do you do these people?" He says, "They're all fixing them all." And he says, "You know." So he explained to him where the problem was, that it's usually in the elbows, most commonly in the shoulder. And he started thinking, he said, "Okay, it makes a little sense," and he said, "Well, this is what I do, and they'll get better." So this surgeon was, not a guy that wanted to operate a lot, and so they did a research project, and they took a cadaver, which is a dead person, and those nerves will still transmit electricity when you send electricity to them, and they opened up the carpal tunnel, and they put 4 surgical rods in there. They started with 1, 2, 3, and then it was 4. Which are about the size of knitting needles. And they said the electrical impulse down there and it didn't block it. Well, after a little swelling of a ligament or a little arthritis block it, if 4 surgical rods inside the tunnel didn't change it. So they did this study, and it was funded by Aetna, and they took 295 people and put them through this treatment, and it took an average of 5 treatments to correct it. And a year later, 292 of them still had no problems. So let me show you a little bit about that technique. So when you're having pains that are in your elbow or in your wrist or in your arm or in your shoulder, the most common cause of it are repetitive movements. Okay? If you're painting, if you're washing your car, constantly doing the same thing over and over, using the same muscle over and over, will injure it and irritate it, cause it to shorten, cause it to swell. If it swells, it's going to trap the nerve as it travels down your arm. So the most common place, these nerves then, have little orange lines there. They come out of your neck, and they come over here to your shoulder, and they go through what's called your rotator cuff. Okay, and everyone's heard about your rotator cuff. Well, the reason it's called a cuff, C-U-F-F, is because it's just like the cuff that used to be on the bottom of our pants. And it forms a figure 8 around your shoulder bone to hold it in the socket. Well, those nerves have to get through there. And so when we tend to all like this, with our arm up under the pillow, we strain that all night long. And that stress causes those muscles, they're afraid they're going to get torn, so if something gets stretched too long, it contracts and it tightens to prevent the pressure. That closes on the nerves. So that's the most common way. So most of you are patients here, and you've had me work on your shoulder where I push on a muscle and we stretch it out. That's to change the length and reset that length of that muscle, and that will often clear out the nerve entrapment that's going on in there. So the number one thing that you want to do to prevent arm and shoulder problems is to sleep with your armpit closed. Okay? And one of the most common things, a lot of husbands and wives in here, right? And we tend to sleep on the same side all the time, night after night. You're on your right side or you're on your left side. And those common things, you put your arm up under the pillow like this. Right? So we need to avoid doing that. Bring our arm back. The other thing that will happen is you use too big of a pillow. Okay? I'll show you what. Big right example. Trying to go over the floor. Okay. So you're laying on your side, and most of us start out sleeping on our stomachs, right? Mama didn't want us to throw up and drown in it on our back, so we put her on our stomach. Except now we know sleeping on your stomach is what causes SIDS, okay? Sudden death syndrome, because kids will suffocate that way. But we tend to start out sleeping like this, right? Got both arms up under the pillow, and your head's like this. You got this big old fluffy pillow, so your head is hyperextended all the way. And that's a good way to jam your neck. So what you want to do is you want to use a small, a lot of people sleep on two pillows, okay? Can't lay down here, I can't lay down here. I'm not that. So if you have too big of a pillow, you can't see me, so if you see me laying down, what's my neck do? It's really flex forward all night long, okay? Well, if you were to look at an x-ray, you see one in the office. Here's your head from the side, and your neck has this nice curve. Here's your back, here's about where your shoulder. So it has this nice curve. So if my head is flexed forward all night, that's what happens to the curve of my neck. It reverses. Okay, and I exaggerated there, but you get what's called a military spine. That's where you got a straight neck, or if you had a whiplash and you take an x-ray, your neck's very straight, and that's where it's really putting pressure on these nerves and straightening your neck muscles. So you want to have a small little nothing feather pillow, okay? So that your head, you can kind of take your pillow and roll it up under your neck so that your head maintains that curve. However, very few of us sleep on our back all night long. Okay? So we don't tend to sleep on our stomach. Stomach sleeping is the worst thing you can do. It is going to distort your neck because you can't sleep face down, so you have to turn your head to one side, and then the pillow causes you to hyperextend. So in your neck, as the vertebrae come down the side, exaggerate this, there's a hole where the nerve comes out. Okay, and that's on the inside of your neck, and these nerves are coming out there. So if I'm hyperextending or leaning back one time, I'm going to compress those nerves all on one side of my neck. Those nerves run down into your arm. So you're going to get pain running down into your arm because your brain only knows where the nerve goes. So the most common thing to cause neck and shoulder pain is the position you sleep in. So what you have to do is take. If I'm laying on my side, and I got this big pillow, and it's making me do that all night. So now I'm compressing all the nerves on this side of my neck. I'm also pushing my skull out the way it sits on the first vertebrae. So you want to have a pillow that, my bed is right here, keeps my head in a neutral position. All right? You don't want a big foam rubber pillow. You want a little soft feather pillow that molds to you. A foam pillow is going to push against you all night long. Okay? So when you fall into a nice, good, deep sleep, and all the muscles relax, it's going to push your neck right out of position. Okay? Then you have something like a ceiling fan blowing on your neck, and that'll get you a draft, and that'll really dry out the muscle. And that's what we call torticollis or rotting neck. Whenever people wake up with their neck and can't move their head. And so you have to watch out when we get some good temperature changes around here. Where it really will drop overnight. And so a cool breeze blowing across your neck is a good way to get a neck ache while you're sleeping. The other thing that has come and hopefully gone contour pillows. Okay, and they're flat, and they have a contour on it. And you're supposed to lay on it, and it puts the curve back in your neck. Except, very few of us sleep on our back the whole night long. So what we tend to do is lay on our side on one of these contour pillows. So now you got this curve inside your neck that's supposed to be straight, so now it's putting a sideways curve in your neck all night long. It's really putting a lot of pressure on it. So contour pillows sound good, the sales pitch was good. I think they're the most horrible thing ever invented. Okay? Just a plain old nothing feather pillow. A lot of people sleep on two pillows because it helps them breathe. You know, they don't breathe as well if they lay flat. So what you want to do is, if that happens to be your problem, or people would prop up on pillows if they had a hiatal hernia. Okay? What you do is you put a couple pieces of 2x4 under the legs of the bed and elevate the bed so it's on a slant. Right? And that way it's still straight and the pillow still has you in a good neutral position. The possible places that the nerves are going to get trapped are in your shoulder, okay, in your elbow. So what you do is feel around here on the sides of your elbow and see if those muscles are tender. Okay? That's where the nerves that are passing through down to your wrist come from. So if you have pain in your wrist, it's either going to be right here in the side of your elbow. They used to call this tennis elbow. Okay? Tennis players would constantly be flicking their wrist. And then the top side they would call golf elbow because it was a different movement. It basically comes from doing repetitive movements all the time. Like Miss Ann's always flipping papers. Okay? So that puts a lot of strain on her left shoulder. One, because she has to elevate it above the door, and then it's the same movement over and over. So what you need to do is you need to stretch these muscles back out. So what you're going to do is you're going to take your arm, bend it, kind of grab the muscles where they're sore, and stretch them out, and bend your wrist in. Okay? So we're kind of grabbing it, going out, stretching your wrist up. Okay? Then the top one is kind of like, has to go this way. Right? So you're kind of going like this and stretching it out. Now, a lot of times people will get a pain right here on the bony tip of their elbow. Okay? And it's sore, and you bump it, okay, and it never fails. When it's bothering you, you bump it on every door you walk through, every place you go. What happens is your bicep, that's this big muscle here, comes down. The reason it's called the bicep means two, right? Well, that means it has two tendons. And one tendon goes to this bone, and one tendon goes to this bone. So when a muscle is injured, what happens to it? Shortens. Okay? So it gets tight, so we want to stretch it. Well, if you're having elbow pain, a lot of times it's coming from your bicep being too short. And you're going to come up here in the top, and you're going to find some sore spots up in this upper third. Okay, come up a little higher. So what you do is you take your arm, okay, find that sore spot. And what we want to do is just get a little bit south of the sore spot, put the flat of your finger on it, and then stretch your arm. So you can break up those adhesives. Sometimes you'll feel a little crunching, like Rice Krispies popping. That's where the injured area is. You need to reset the length of that muscle. And that's where all your elbow problems are coming from, usually from your bicep. And it happens from carrying stuff, pulling the cord to get something started. Right? Repetitive movements are the most common cause of any injury, which means if I do this, nothing happens. If I stood here and did it 3,000 times, she'd have one heck of a bruise. So if you do the same movement over and over, whether it's on a keyboard, okay, whether it's writing, whether it's whatever your job is or your sport is, it's this repetitive movements over and over. So you need to reset the length and stretch it. Another common area that affects your shoulders is your chest muscles. As we get older, okay, hang there for at least 45 seconds because muscles are going to fight. If you go to stretch a muscle, it contracts to prevent being torn. So it's kind of like Turkish stabbing. It'll resist, and after about 30 or 40 seconds, it's going to start letting go. So you do that for 45 seconds. Right now I'm laying on my back. Bring your hands up, clap a couple times, take it out and do it again. Okay? You slowly want to get to where you elevate your arms and stretch this way. You can see it's the higher up you go, the tighter it's going to be. And just let that stretch, just like gravity do it. Your arm weighs 16 to 20 pounds. Right? So that's plenty enough pressure just letting gravity stretch out your arms. So what happens is, especially when we exercise, people go into the gym, men more than women, but everyone wants to build up their chest, okay, or build up their biceps. So they're constantly strengthening these muscles, which pull everything forward along with gravity. What you really need to work on is you need to work on strengthening your back muscles. The easiest way to do this is with a piece of rubber tubing, okay, like we have at the office. We show you exercises, and Melissa has them. If you want copies of them, we did an exercise class. But basically, you're going to take the tubing, attach it to a doorknob or something, and take the arm out. Okay? Don't go in because that's already strong. Everything in your body is a pulley system. It's all balanced. Right? One side's too strong, you're going to move to that side. So it's not necessarily that you have to stretch the short side. You need to strengthen the long side. Okay? Because it's gotten stretched out, your body takes up the slack by contracting the front muscles. So if you want to stretch one set of muscles, you strengthen the other set and now stretch them. So those are the biggest, most common things that occur in your arm. So I can't reinforce it. Sleeping is the number one cause of all these things. Okay? I don't know. Okay? When he sleeps good, his arm doesn't hurt. In this bad position, it starts bothering you. And your neck are the nerves and the power that control these muscles. If a nerve is constantly irritated, it's constantly sending an electrical impulse to that muscle, and it causes it to contract and tighten and stay tight. So just stretching it alone, we got to get our necks going. So one of the things you want to do is you want to sit up nice and straight, okay? And you're going to imagine that you have a pencil sticking out of the top of your head. We're going to draw a perfect circle on the ceiling. So I take my pencil, tilt it all the way to the back of the circle. I go out this side, go down that way, down in the front, all the way down, and in the back. And I go this direction 3 times. Okay? And then I'm going to go the other direction. And you're going to hear crunching and crackling. Those are all your joints breaking up scar tissue and rust. See, the joints of the body are self-lubricating. What that means is if they move, they lubricate themselves. If they lock up and they don't move, they dry out and become arthritic. So that's a great little exercise to do every day and just do 3 circles. Don't do it first thing in the morning when you wake up. Give your muscles and everything a chance to wake up. You're going to do it and you're going to find you just get a flat spot where it feels like it catches. Because you have 7 vertebrae and they all have to mesh together. But when you got one that's out of alignment, it's like the gears jam. So you want to work out that spot. Don't force it to the point it actually hurts, but try and get that going. Okay? One of the other biggest causes of neck and arm pain, especially in women, are thyroid problems. Okay? Your thyroid is a great heat. And when it's under stress, any organ or system of the body is under stress, the muscles around it contract. So your thyroid is active from 10 p.m. to 8 a.m. in the morning. That's when it's doing all its work, when you're sleeping. So if you get arm pain and you also get foot cramps at night, okay, most of it's going to be coming from your thyroid, and that's a calcium magnesium deficiency. Okay. So we can reach the thyroid enzyme, which has a lot of calcium and magnesium in it. So think about that. If you got arm pain and you get foot cramps at night while you're sleeping, it might be coming from your thyroid. And thyroid is going to cause muscles to contract, which is kind of going to pull things out of alignment. So you need to correct both. But if, you know, as I tell people when you come to me, you can go to a chiropractor forever and it ain't getting better. It's not just a simple misalignment. There's a chemical or nutritional component to it. So we need to correct that so the muscles don't contract to pull things out of the line. Okay. Question. That's a question. Specific problems. Anybody?
I have pain in my front bill.
And you don't. Okay. Your rotator cuff comes right, it all attaches right about right here. So most of the pain in your shoulder is going to be from your rotator cuff. So what happens is, if you feel like you elevate your arm and it catches, you get about right here, that's because the firing order of the two muscles are out of sync. Okay? So what happens is, oh no, don't get it. So we have our scapula, and that has a cup on it. And then we have this arm comes up here, and there's a ball. Should be a ball that fits into that socket. So then there's our big deltoid muscle that comes over the top. And that's the big muscle out here on the end, and that lifts your arm up. Okay? What happens is, and then there's a little muscle right down here that's on the front side of your scapula. It's called subscapularis. Part of your rotator cuff. Just remember that. And what happens is that if this muscle needs to go first and pull that ball down in the socket, and then this muscle can lift it up, and this thing just kind of floats in there. Okay? But if the firing order gets reversed, so what happens is as it lifts up, that little muscle over here pulls this guy down so he doesn't slam up into the roof. If it doesn't work, as soon as your deltoid contracts, it slams up into the roof. And that's called an impingement syndrome. And that's the most common way that you tear your rotator cuff. What happens is, there's a muscle that comes right through here and attaches right out here, which they were saying that it hurts. And then you have this bone up here that's kind of part of your clavicle. That's your little tippy bone you feel right here on the edge. And that tendon, when this pulls up, pinches that tendon between the two bones. And that's why it'll catch right about here, about 70 degrees. And that's what's called impingement syndrome. Well, if that tendon keeps getting slammed in between the two bones, it starts to fray. And you'll end up with a rotator cuff tear. And it's because this muscle over here isn't doing its job when you lift your arm. So what you want to do to reset that is you just kind of hold your arm against your side and you push out for 5 seconds. 1, 2, 3, 4, 5. And then relax. Then push out again. 1, 2, 3, 4, 5. Alright, and do that 3 times. Okay, and then try and lift your arm. And it'll go up much easier. So if you're catching, your shoulder's catching on you when you grab for things, you're reaching, that's because you're pinching that tendon between the two bones, and it sets off an alarm, and man, it grabs you and you let go. So you need to reset it. You could do it pushing against a wall or something. Just push out. The object is don't let your arm leave your side. Just hold it against your side. The easiest way is just hold it with the other bone. Push out for 5 seconds, and relax. Push out, and relax. So if you can't break that habit of sleeping like this, make sure you reset it when you get up in the morning, because you just screwed up that firing order and put a lot of pressure on that tendon. The other way, the best way to strengthen your rotator cuff is to take a little 3-pound weight, you know, 3-pound weight, take a can of soup or a can of beans or something, weigh something out of the cupboard, And you're going to lay on the ground. And you can put your arm out here like this. You have a 90-degree angle at your shoulder and a 90-degree angle at your elbow. I got a little weight in my hand. And I'm going to go from here to here. And what you're going to see is, boy, right about here it stops and it's stuck and it's pulling.
Little problem.
No problem. Okay? So one of the things I want to do is I want to kind of go slow with this. See, I'm going to plot. Okay? And let it stretch it out for 30 seconds. Then do your set. 1, 2, and maybe you do 8. 10 is ideal. Alright? Then we're going to go and we're going to go down in this direction. Okay? And you're going to see, boy, this just really stops right about here. So again, we want to just kind of hold that weight and let it stretch all the way out till it kind of gets down to the floor. Your tendency is going to be to cheat, bring your elbow down. Okay? So try and maintain it up here. If it's really short and you can't get there, put a pillow there so you have an input. Okay? And then you go from there up. 10 times. Okay? This is the best way to strengthen your rotator cuff. Okay? Do both sides. Another really good exercise, and it's better with tubing, is to turn your thumb down, and you go from this hip out to here. Okay? You could do it with a weight, but the rubber works better because it follows you through the whole way. Weights just work against gravity. So you take a little bungee cord or something, get a piece of rubber tubing. I mean, you're really cheap. That's the best form of exercise. For $15, you got a whole gym in your hand. And it's really important that you exercise and strengthen your shoulders. So we want to do going back. Okay? There's my tubing, it's over here, and I'm coming out like this. Okay? I want to face it and pull back this way. Okay? And then I want to turn my hand down and step on the tubing with my foot and just lift up like this. Okay? That's the most important thing, exercise. If you don't do any exercises, do shoulder exercises. Because the most common injury as we get older are rotator cuff injuries and shoulder problems. And when this is not sitting in that socket, bone rubbing against bone causes bone spurs. Bone spurs are just like calluses you get on your hands from doing a lot of hard work or rubbing all the time. So when those bones keep rubbing, that starts to wear the cartilage, that's the cushioning in there, and that causes a bone spur. When you get a bone spur rubbing on a tendon, that's like a rope rubbing over a rock. Sooner or later, it's going to fray. Okay.
How many reps?
I would say, if it's new to you, do 2 sets of 5. The turtle always wins the race. Okay? And gradually increase it. Next week, do 2 sets, 7. Work up to 10. 10 is the ideal number. Okay? Larger muscles like thigh muscles, things like that, we do reps of 15. But shoulder muscles, so you want to, we talked about the bicep, you want to stretch this, just simple stretch. Okay? Another good stretch for your shoulders is to just put your hands on the counter, thumbs up, always thumbs up, and just slide back. And just stretch that. Okay? Come up. And do everything slow and gradual and let this gravity and your natural weight just slowly move that. Don't force it. Don't try and rip it. Just kind of stand here for a good 30 seconds. Okay? Come all the way up. Put it back up. Stretch it again. The reason you put your thumb up is put your hands flat like this. Just do one of them. And lift your arm up and see how far it goes. Kind of stops right at 90 degrees. Okay, unless you turn your thumb. Okay, because there's a bone that's a little lump on the outside runs into the other bone. So if you turn your thumb now, you can go up all the way. can do